Good evening, everyone. My next video is on the topic P-Talk Exercise 3. In the previous videos, I discussed with you on the mild hypertension and acute attack of angina. In this video, I will discuss with you P-Talk exercise on peptic ulcer disease. And before I start my video, I want to request you, if you like this video and if it is useful to you and if it is helpful to you, kindly subscribe to my YouTube channel. This is Dr. Nitika Pharmacology Discussion. So now I'm going to discuss with you on the topic P-drug exercise. 3, that is the peptic ulcer disease basically. Now case histories: an Indian 45 years old man came with complaint of pain in epigastric region. There's pain in the epigastric region in the 45 years old man, which aggravates with consumption of food. There's pain in the epigastric region which aggravates, means which increases with consumption of food from past 6 to 7 months. History of burning sensation in the chest. There is history of burning sensation in the chest. No history of NSAID use. Results for H. pylori infection test was negative. Upper GI endoscopy revealed ulcer 10 to 8 millimeter size in the antrum of the stomach. Means there was ulcer, there was pain in the epigastric region, and there was which aggravates on consumption of the food. And it was from the 6 to 7 months. Such as this is a chronic disease, and there is no H. pylori infection was negative result. So it is the peptic ulcer disease. How will you manage this case? Diagnosis is the peptic ulcer disease, gastric ulcer. Objectives are we can decrease the symptoms of the objective of the treatment is we can relieve the symptoms, we can heal the ulcer, and we can prevent the complications like perforation. Heal the ulcer by suppression of the acid secretion. So treatment options available are proton pump inhibitors, H2 receptor blockers, and antacids. Basically, the proton pump inhibitors, these are basically the most efficacious and first line drug of choice for the treatment of peptic ulcer disease. This is given empty stomach in the morning, and they irreversibly inhibit the sodium potassium ATPase pump. Hydrogen potassium ATPase pump is inhibited, and they inhibit irreversibly the pump. And they also heal the ulcer. They decrease the relapse also, they heal the ulcer also. So chances of perforation are also reduced. And these are the most efficacious drugs used. Decrease the relapse, heal the ulcer, and these are quite efficacious drugs. H2 receptor blockers and antacids are less efficacious as compared to proton pump inhibitors. Antacids only neutralize the acid. These are the weak bases which only neutralize the acid and do not decrease the acid production, whereas proton pump inhibitors and H2 receptor blockers decrease the acid production also. The proton pump inhibitors, these are the safer drugs. Tolerability is also more as compared to H2 receptor blockers and antacids, and these are most efficacious drugs. And price-wise, though they may be costly, but their efficacy is more. They are most efficacious drugs as compared to H2 receptor blockers and antacids. So these are the first-line drug of choice, proton pump inhibitors. H2 receptor blockers are given in the night time, but they have a side effect of the sedation, and many other side effects are there, some small side effects. Antacids, these are less efficacious, they only neutralize the acid, so less efficacious. And so proton pump inhibitors are the effective drug of choice for the treatment of the peptic ulcer. P-drug will be from proton pump inhibitors because safety, tolerability, and efficacy is more as comparable to H2 receptor blocker and antacids. Because this is the P-drug will be from the proton pump inhibitors, because safety, suitability, efficacy is more as compared to H2 receptor blocker and antacids. What will be the P-drug among different PPIs, such as omeprazole, esomeprazole, 40 mg, esomeprazole 40 mg, pantoprazole 40 mg, lansoprazole 30 mg, reviprazole 20 mg. All the three criteria are same. This is safety, tolerability, and efficacy same of all the drugs. Difference lies in the price. This is esomeprazole is 30 rupees and omeprazole is 32 rupees. But omeprazole uh, dose is 20 milligram and esomeprazole dose is 40 milligram. So we can say that omeprazole 20 milligram number 2 is more potent as compared to esomeprazole 40 milligram OD, which is less potent, because less dose required can produce the same therapeutic response. So, esomeprazole 40 milligram is less potent as compared to rabeprazole 20 milligram. So, rabeprazole 20 milligram OD is the drug of choice, potent form inhibitor of the choice for the treatment of peptic ulcer. So, that's all for my video on the peptic ulcer disease. I hope you like this video. And if you like this video, kindly subscribe to my YouTube channel. This is Dr. Ritika Pharmacology Discussion. Thank you. Be happy, be healthy, be blessed, stay safe, happy learning. Thank you.